Are you pregnant and confused about the different tests your doctor is recommending? You might have heard of something called the Quadruple Marker Test. What is it? Why is it important? And should you take it? In this video, I'll break it all down in the simplest way possible so you feel confident and informed during your pregnancy journey.
Hi everyone, welcome back to our channel. Today, we're diving into a very important topic, the Quadruple Marker Test. If you're in your second trimester of pregnancy, or you know someone who is, this test can provide valuable information about your baby's health. Stay with me till the end because I'll also share what the results mean, why timing is important, and what to do next if your results come back abnormal. What is the Quadruple Marker Test? Let's start simple. The Quadruple Marker Test is a screening test done during pregnancy. It's not a diagnostic test, meaning it doesn't confirm a condition, but it tells us if there is a higher or lower risk for certain genetic or chromosomal abnormalities in the baby. It's called quadruple because it measures 4 specific substances in the mother's blood: alpha-fetoprotein, AFP, a protein made by the baby's liver; human chorionic gonadotropin, HCG, a hormone produced by the placenta; estriol, an estrogen made by the placenta and the baby's liver; inhibin A, a hormone released by the placenta. By looking at the levels of these 4 markers together, doctors can estimate the risk of certain conditions.
Why is the Quadruple Marker Test done? So, why do doctors suggest this test? The main purpose is to screen for certain conditions such as Down syndrome, Trisomy 21, Trisomy 18, neural tube defects like spina bifida. This test gives doctors and parents an early indication if there might be a higher chance of these conditions, so further diagnostic testing like amniocentesis can be considered if needed. It's important to remember, the Quadruple Marker Test does not diagnose any condition. It only estimates risk.
When is the test done?
Timing is everything with this test. It's usually done between 15 and 20 weeks of pregnancy, with the best time around the 16th to 18th week. Why this window? Because that's when the levels of these 4 markers are most reliable for screening.
How is the test done?
The good news is, it's a very simple and safe test. All it requires is a blood sample from the mother's arm. No fasting is needed, no special preparation is required. After that, the blood is sent to a lab for analysis, and the results usually come back in a few days. How to read the results? Now, this is where many parents get anxious. What do the results actually mean? The test results are reported as a risk ratio. For example, 1 in 100, 1 in 1,000, and so on. If the risk is higher than average, your doctor may suggest additional tests, such as amniocentesis or ultrasound. If the risk is low, it means the chance of the baby having one of these conditions is very small, but not zero. Remember, a positive screening result does not mean your baby definitely has a problem, and a negative result does not guarantee that your baby has no issues. It's simply a screening tool. There are several factors that can influence the Quadruple Marker Test results, including the mother's age, weight, ethnicity, multiple pregnancies like twins or triplets, accurate knowledge of how far along the pregnancy is. Because of these factors, doctors often combine the test results with ultrasound findings and maternal history to get a clearer picture. So why is this test useful? It's non-invasive and safe. It can help parents prepare emotionally and medically if there's a higher risk. It gives doctors important information to decide if more advanced testing is needed. For many families, this test provides peace of mind during pregnancy. But there are also limitations. It's not 100% accurate. It only screens for certain conditions. Sometimes it may give false positives or false negatives. That's why doctors emphasize that it's a screening tool, not a diagnostic one. This is a very common question. If your Quadruple Marker Test shows a higher risk,
don't panic. Your doctor will likely recommend a detailed ultrasound, possibly an amniocentesis or chorionic villus sampling for confirmation. These follow-up tests can give a more definite answer about the baby's health. Always remember, the quadruple marker test is just the first step.
So, to summarize, the quadruple marker test is a safe blood test done in the second trimester that helps estimate the risk of certain genetic and birth defects in your baby. It's not a diagnostic test, but it's an important part of prenatal care. If you're pregnant and your doctor recommends it, know that it's just to give you and your healthcare team more information to ensure the best care for you and your baby. Now I'd love to hear from you. Do you have any questions about the quadruple marker test? Or is there a specific part of pregnancy screening you'd like me to cover in another video? Leave your questions and thoughts in the comments below. We're here to help you. And if you found this video useful, don't forget to like, share, and subscribe for more health information made simple.